Welcome to the Radiologic Technology information video. It is important that you do watch the entire video as we will be discussing information on the medical imaging profession as well as the details regarding the application process for this upcoming year. The new deadline will be January 29th, 2015. At the end of the video there will be a short quiz that you will need to complete as part of the requirements for the application process. The program director for the Radiologic Technology is Ms. Lauren Huffman. You can contact me at lhuffman@zanestate.edu. The clinical coordinator for the program is Ms. Lauren Mack. You can contact her at lmack@zanestate.edu. The Radiology Faculty Office has now moved to the Advanced Science and Technology Center, room 145. I'd like to take a few minutes to discuss what a radiographer is. A radiographer is a medical imaging professional who works under the direct supervision of a radiologist. Now, many people think that a radiographer and a radiologist are the same thing and that those two terms are interchangeable. However, they are two very different professions. The radiographer, which is what our program prepares graduates to become, is the person that is responsible for providing patient care and obtaining the images that we will give to the radiologist. The radiologist is a medical doctor who interprets those images in order to aid in the diagnosis and treatment for patients. We do also work very closely with other health team members. Most facilities, we will be working with nursing staff, medical lab staff, medical assisting, physical therapists, occupational therapists. So there's a wide variety of other healthcare members that we do interact and communicate with. Some of the main duties of a radiographer is to provide quality patient care, and that includes good radiation protection practices. During the curriculum in the program, students will learn how to provide good patient care and also good radiation protection. Now, as part of providing good patient care, we do communicate very closely with our patients. Many people think that we just take x-rays and we don't have much interaction with our patients, and that is completely false. We do very much become involved with our patients. We have very close personal communication with them as we're obtaining their history and trying to make them comfortable during their exam. And in order to ensure that we do provide good quality images, we do have to make sure that our positioning is correct and accurate. So there will be touching of patients in order to feel for certain bone landmarks that we use in our positioning. We also deal with bodily fluids as well. So we deal with blood in trauma situations. We also deal with vomit if people are not feeling well and are nauseated. We also deal with urine and feces as well. So just wanted to put that up front and be honest with what all that you will be involved with. And I'm hoping that when you go out and do your observation hours that you really take note and use that time to find out what exactly it is we do and to ask the technologists and the students, if they're there, lots of questions. Some of the different areas that we're involved in radiography are just our routine type of exams, such as our chest x-rays, abdomens, hands, feet. We can image any bone within the body. And for many people, that's what they think that we do, and it ends there. But we certainly do so much more than just x-raying, bones and hands and feet. We do have fluoroscopy. Fluoroscopy includes some exams such as upper GIs and barium enemas. We can also go to surgery. There's a number of surgical exams that the surgeon will need images taken while that surgery is progressing. So we are right in the surgery suite while that surgery is happening. We also deal with traumas. Now, depending on where you might have your clinical site at or where you gain employment, some facilities don't really deal with trauma a lot. And then if you work in an inner city, more than likely you will see lots of traumas. We also deal with pediatrics and geriatrics, so kids and the very elderly as well. As far as our patient population that we interact with, it's anybody. Our patients are all shapes and sizes and ages, so we deal with everybody. You can certainly specialize in different areas, so if you wanted to work with kids, you can find employment at a pediatric facility. Some of the different employment settings that we have, our largest employer are hospitals. However, you can obtain employment at physicians' offices, outpatient clinics, mobile companies where they load a mobile X-ray unit onto into a truck or car, and they'll go out to the nursing homes and take images there instead of having the patient come to the hospital. You can also get employment in surgical centers. If you would like more information, you can visit any of these professional organizations. Now we're going to go through the actual information packet. This is for our upcoming deadline. If you have previously applied to the program and if you submitted a packet last year, you can make an appointment with myself, and you can come into the radiology faculty office and you can sign out your packet, and then you will just need to work on revising that packet based off of this year's criteria. Our new deadline for the upcoming year is Thursday, January 29th, 2015 by 5 o'clock. This deadline is very firm. We are a selective admission program, so what that means is that we usually have more applicants than we have spots for. So if we would happen to have somebody turn in a folder on Friday morning, January 30th at 9 a.m., we will have to turn that folder away because we would probably have enough folders already to fill the class. So that deadline is very, very important, and please mark your calendars. So this is going to be the end of week 2 of spring semester. You'll definitely want to allow yourself enough time in order to put your folder together, especially if you have transfer credit coming in from other institutions. You will need to submit those official transcripts to our registrar's office for transfer evaluation, so you want to allow yourself enough time for that evaluation to happen. All of the RAD classes on our courses study, which we will go over a little bit later in the video, is strictly for accepted radiology students. However, you can enroll and take any general education course prior to the time of application, and I would very much encourage you to do so. If you have any questions on the application process or with the profession in general, you can certainly contact me. The best way is via email. We usually get a quicker response that way. However, you can certainly call me as well. My number is 588-1241. A little bit later in the video, we will go over exactly what is needed for your folder. However, some of the things that we do look at and what we score in our packet is high school math and science grades and GPA, college math and science grades and GPA. Now for the college GPA or even for the high school GPA, if you have multiple institutions that you attended, then we will take the average of all of those GPAs together. Your health occupations aptitude exam score, answers to some essay questions, which you're going to do some research, your clinical observation evaluations, and any work experience that you have with the public or in healthcare. Now, we do usually take about 16 to 18 students per year. The number that we can take is based off of the number of students we can place in our clinical sites. We certainly don't want to have 10 students at a site where there might be only 5 technologists to supervise. So we look at the number of technologists that are going to be available to supervise students, as well as the number of procedures that are going on as well. So that way our students get a really good educational experience in the clinical setting. Once students are accepted into the radiology program, it is very much like a part-time job. First year students can expect to be in class and or clinic about 4 days a week. And then once you reach your second year, students can expect to be in class and clinic 5 days a week. Primarily Monday through Friday, day shift. However, we do have some clinical rotations which will be in afternoon rotations, and then we also have a weekend midnight rotation as well. The radiology program is fully accredited by the Joint Review Committee on Education in Radiologic Technology. So our students can go and sit for the National Registry exam after graduation. Our program is 6 semesters in length, and we will go through the course of study. We do only accept students once per year, so if you would happen to miss this January 2015 deadline, then you would need to wait until the following January of 2016 to reapply again. Again, the program is competitive admission, meaning that there are more applicants than we have spots for. Number 13 is very important. If you think that this pertains to you or you have concern, please contact me and we can sit down and go through this. This is not something that you would need to do prior to application. You certainly have that option if you wish to do that, but once you are conditionally accepted as a radiology student, this is where we would do background checks. Anybody that has a previous conviction of a felony or misdemeanor, excluding any type of parking violations or speeding tickets, must report that to the American Registry of Radiologic Technologists, or the ARRT. This is the organization that will administer our national registry. The Ethics Committee will review that conviction, and they will determine whether or not somebody can actually sit for the registry exam. So if you think this is a concern for you or it might pertain to you, please feel free to contact me and I can sit down and go through that with you. Once students are conditionally accepted into the program, and when we say conditionally accepted, that just means that there are some other steps to do before they start classes, such as getting a physical, a background check, making sure that you're CPR certified, getting your TB tests and Hep B immunizations, and all of those are at the student's expense. We currently have 3 base sites where we will place students. Our students will be placed at one site during their first year, and then during their second year they will switch to a new base site. Currently our base sites are Genesis Good Samaritan Hospital in Zanesville, Southeastern Med in Cambridge, and then Union Hospital in Dover. We do have additional rotational sites where students will spend a limited amount of time at. We have the Genesis Cambridge Healthcare location, and then we also have the Orthopedic Associates of Zanesville, which is a orthopedic physician's office. Students are responsible for getting to clinic and providing their own transportation, and we do make every possible effort to place students at the site closest to their residence. However, that is not a guarantee. So please be aware that there is a possibility that you might have to commute to your clinical setting. I will allow you to review the technical standards on your own. This gives a pretty good detailed list of everything that we're going to be doing as radiographers as it pertains to more of our physical demand of the job. So we do lots of pushing and pulling, lifting, stooping, reaching. We walk a lot because sometimes we have to take a portable machine to the floors in the hospital. So we certainly have a very physical job. As previously stated, we are accredited through the JRCERT. And if you have any communications of concerns regarding the program, you can certainly contact them at their information listed here. The purpose of the program is to prepare our students for professional careers as radiographers. This will give you a good idea of all of the different areas that we will be teaching in our curriculum. And these are the program goals and student learning outcomes. So when somebody graduates from our program, they're going to be able to do all of these objectives or outcomes. Now, it might seem like a very short list, but in each class we certainly kind of break this down even more into very detailed objectives. And you can see our completion rate, our exam pass rate, and our job placement rate for the past 5 years. We very much pride our program in having a fabulous exam pass rate. So what can you do to ensure that you have every opportunity to be considered for the program? Well, the first piece of advice that I can give you is to start early. The more time that you allow yourself to prepare your packet, the more professional it's going to look, and then that way you can ensure that you do have everything included in that packet when you submit it. The Health Occupations exam, aptitude exam, is only scheduled during the very last part of fall semester, so be checking in the Student Success Center as to when those dates are going to start to open up, and make sure that you schedule early. There is a fee associated with that aptitude exam, and I believe it's, I think, $25 or $30 for that. And make sure that you're scheduling your hospital observation hours early. At the clinical settings, they only allow one student at a time, so that way it gives each student a really good opportunity to see all the exams and to kind of have some one-on-one time in the department to ask questions. The radiology program does not have a wait list. We have our students apply fresh every year against everybody, and application does not guarantee admission. We usually recommend students allow a minimum of 1 month to get their packet together. However, allowing more time, 2 to 3 months, will be beneficial. Again, our application deadline is Thursday, January 29th at 5 p.m. and materials can be turned into the Radiology Program Office in the Advanced Science and Technology Center. All materials must be turned in at one time. So when you put your folder together, you're going to use a 3-prong folder, and you're going to put your materials in a very specific order, which we will discuss in a few minutes. We will not accept any 3-ring binders, so if you would turn a 3-ring binder in, your packet will not be scored. You can purchase the flat 3-prong folders. I believe that they have them in the bookstore for less than $1. It does not matter what color it is, it doesn't matter if it's clear on the outside, but it has to be a 3-prong folder. We do have sample packets available for you to look at. You can't take them off campus, but they are located in the Radiology Faculty Office, in the Advanced Science and Technology Center. We also have one in the Resource Center. And then we also have a copy in the Student Success Center as well. So if you would like to see an example of how a correctly put together folder is, those where you can find the samples. We currently do not have face-to-face interviews for our application process. However, we do consider your application packet to be a written interview. So it is very important that you ensure that your entire packet is complete with all of the required documentation and that it is presented in a professional manner. So that means everything, as much as possible, should be typed. There should be very little handwritten areas. If you have not done so yet, you will want to apply to Zane State College and list radiology or RADT as your program of study. If you do have transfer credit from other institutions that you've attended, please send official transcripts to our registrar's office and they will evaluate that for transfer credit. You will receive an official letter from the registrar's office detailing which courses you have been given credit for. You will definitely need to keep that because that will go in to your packet. You need to attend at least one of the mandatory information sessions, and since you're watching the video, that fulfills that requirement as long as you complete that post quiz at the end. You are also welcome to attend a face-to-face information session, which we will be offering during summer and fall semesters. Dates for the face-to-face sessions can be found on our radiology webpage on our Zane State website. We do have a minimum of a 2.5 GPA on a 4.0 scale. And again, that's looking at high school and or college, whichever is the most recent. And again, if you have multiple GPAs, say you've attended Zane State and maybe you attended OUZ, we will combine those two and average them together to get your average GPA. We do require a minimum of a 40 on your health occupations aptitude exam, and that's kind of the composite score across all of the different sections. Again, this exam is offered very limitedly at the end of fall semester, so it is important that you keep in contact with the Student Success Center in terms of when they're going to start offering those. And that is going to be scheduled through the Student Success Center, and you can call them at 588-1261. There is a 2-time limit to take the aptitude exam, so if you would take it during your first time and you would not earn a 40 on that, I would advise you to contact me and we can sit down and talk about what your best next step would be, whether to take it right away again or to wait. It is recommended that you are taking college level courses, since there is some biology, some spelling, reading comprehension. However, it's not required that you be in college level courses. It's just recommended based off of what's going to be on the exam. If you need to complete the AccuPlacer, this is our placement test for your math and your English courses. You're also going to be submitting a 3 to 4 page paper answering some questions about the profession, and we'll discuss details about that a little bit later on. We'll also be discussing later your hospital observation hours. We do require a minimum of 12 hours at 3 of our base sites. You can certainly complete more than 12 hours if you wish to. However, that will not increase any type of points towards admission. If you do choose to go over the 12-hour minimum, that's just a personal preference for you if you want some more time. Again, if you've ever attended any other previous colleges, you'll need to submit those official transcripts to the registrar's office. In your packet, you will also need to include a high school transcript or a GED certificate, and then also any college transcripts as well. Now, your high school and your college transcripts do not have to be official for your radiology packet. They can just be copies. So for a student to be eligible for us to score your packet, you need to make sure that you submit all of the required materials and documentation by the deadline, and that you also meet all of the admission requirements, such as your college level. So you need to be ready to go into English 1500 or Composition 1. You need to be ready to go into Math 1340, College Algebra, and then also need to be ready to go into Biology 2400 and 2410, which is our Anatomy and Physiology 1 and then the corresponding lab. This also includes the minimum of a 40 on your health occupations aptitude exam, and then also the minimum of a 2.5 GPA. Once we determine that somebody has met the eligibility requirements, we will go through and we will score. Later on in this packet, you can see the score sheet that we use. We do award points on a graduated scale, which you will see in a little bit. So an A is worth more points than a B, which is worth more points than a C. We do not look at anything below a C. Once we go through after the deadline and we score all of the packets, we will be sending out letters via snail mail, and you'll receive one of 3 letters. You'll receive a letter that you were conditionally accepted, and again, that just means that you have some next steps to take with your physical and CPR in order to continue on with the classes. You might receive a letter that says that unfortunately you've not been accepted, That does not mean that you did anything wrong in the application process. It just means that there were, people who scored higher than you. The third letter that you might receive is that you are an alternate for the program. That's probably the hardest position to be in. Like I said, we accept 16 to 18 students depending on how many we can place at clinic. However, we usually also take a few alternates because some of our students are applying to multiple programs and we might not be their first choice if they are accepted into a program at another facility. And sometimes we also have students that just decide that, now's not the right time for them to pursue the program. So being an alternate is probably the hardest because you're kind of sitting on the fence. You're waiting for a spot to open up. We will send letters out on or before February 21st, so please don't contact me 3 days after the deadline and ask whether, you've been accepted to the program, because it does take a good bit of time to go through everybody's packets, make sure that we're scoring everybody correctly and grading those essays. So it does take us some time to do that. So please wait until February 21st before you contact us. As I said, even though you cannot enroll in any of the radiology courses until you are accepted as a radiology student, you can certainly enroll in general education courses. And you can enroll either in the health core curriculum, or an associate of science, or an associate of arts, or we also have an associate of science which has a healthcare concentration as well. So if you would like advising for any of that, I can certainly help you with that. Courses that the student is currently enrolled in at the time of application, so courses that you will be taking spring semester of 2015, will not be scored because you do not have a grade for those yet. For the math requirement for application, you do need to be ready to go into Math 1340 at the time of application. So that means that you need to have completed or received transfer credit for Math 1240 at the end of fall semester 2014. Your English requirement is that you be ready to go into English 1500 at the time of application. And then with your biology, you'll need to be ready to go into Anatomy and Physiology 1, which is our Biology 2400. So you'll need to meet the prereq for that. The prereq for the A&P 1 course is currently in a transition stage. In the past, it has been Biology 1010, which is our Introduction to Biology course. However, that is transitioning to the new prerequisite, which is Biology 1210. For this upcoming application, either of these two courses will be acceptable as the prereq for the Anatomy and Physiology 1. Since we do work around radiation, and radiation can be harmful to living tissue, we do have a student pregnancy policy, and our pregnancy policy just states that a student does not have to declare to us that she is pregnant. It is voluntary disclosure. However, we do encourage our students to declare when they are pregnant. It does not mean at all that you would be kicked out of the program because you had gotten pregnant. We usually have at least one pregnancy in each class, but there are some options that you have in terms of maybe switching things up to provide some radiation protection. This is a very, very important page. This page you will include in your packet. So this is the specific order that you're going to place the documents in that 3-prong folder. Please make sure that you do place your full name on the outside of your folder. It just makes it so much more easy for us when we are going through and scoring everybody. So the very first page inside of your folder, and none of these papers have to go in sheet protectors. You don't have to use sheet protectors at all. So the first page is going to be the application form, which is at the very back of this application or information packet. Your second page is going to be this checklist. This checklist is for you. So you're going to go through and you're going to check off and make sure that you have everything in your packet. And then it also allows us to go down the side too and check off and make sure that you have everything in your packet. The next page is your high school transcript or GED certificate. Again, this can just be a copy. It doesn't have to be official. The fourth page is going to be, or the fourth section will be, any transcripts you have from colleges, including Zane State. So if you are currently a Zane State student, you can just go into your Z Online and print off an unofficial transcript. You do have to make sure that it does list your GPA on that transcript. So it includes all of the courses you've taken, the grades that you've received for those, and then also your cumulative GPA. And then also copies from any previous colleges that you've attended. Page will be your transfer credit award letter. This might not pertain to everybody. This is only if you've sent in transcripts from another institution to be evaluated for transfer. The next page will be a copy of your health occupations aptitude exam score. Page 7 will be your observation validation forms, which we will go over in just a minute. The next part will be your 3 to 4 page paper answering the essay questions. And then the very last page will be your current resume. So we'll talk about observation just for a minute. If you have applied previously and if you have completed your 12 hours of observation last year, or even the year before, you would not need to recomplete new observation hours. So you would just need to get the validation forms that had your signatures for when you went to your observation time and just make sure it's in this new packet. We do require a minimum of 12 observation hours, and we divide those 12 hours amongst the 3 base sites that we have. So you'll need to do observation time at Southeastern Med, Good Samaritan Hospital, which is Genesis, and then Union Hospital in Dover. So you're going to do 4 hours at each of these sites. That will give you your 12 hours. These are the ladies to contact in order to schedule your observation hours. Observation hours are scheduled primarily Monday through Friday during the day. That just allows you to see the most amount of exams and also a larger variety based off of what's going on in the department. These ladies are also working technologists, so that means that they do have other duties. They are on the floor taking care of patients. So if they don't call you back right away, don't panic. Just give them a few days. Some of them have 1 day a week set aside that they call back people. This is why it's very important to schedule your observation hours early. I can tell you that in the past, it happens every year. We have people waiting until the very last minute. If you choose to wait to the last minute and there's no times available for you, then you will lose out on that observation time and you will not meet eligibility. So it is important to make sure that you allow yourself enough time for your observation hours. If you do need to leave a voice message, please make sure that you leave your full name and also your full telephone number, including your area code. And make sure that you also speak slowly and clearly as well. In the past, we've had some of our clinical instructors call us back and say, this person talks so fast, or they didn't even leave me their name, they just gave me a phone number. So make sure that you're saying your full name, your full telephone number, and speak very clearly. Some of the guidelines that you'll need to follow when you do go to your observation hours. We do require professional attire. So this is no jeans, no shorts, no capris, no tennis shoes. Now you certainly don't need to go out and get a new suit or anything like that. A pair of khakis or dress slacks would be fine. Make sure that you wear comfortable shoes. This is not the time to go get a nice pair of strappy heels, and you will be on your feet for those 4 hours. So make sure you do wear comfortable shoes. You will want to avoid wearing any kind of perfume or cologne. you're going into a health setting where people are sick, and if they're already nauseated and they get a whiff of something that just doesn't agree with them, it might not end nicely for you or your clothes. In the past, we have also had students ask if they can wear scrubs. We prefer that you not wear scrubs. In the hospital, affiliates also prefer that you not wear scrubs. We had an instance a couple years ago where one of the observation students wore scrubs to observation hours, and there was an emergency. They called a code and they thought she worked there, so somebody started barking orders at her to go get a crash cart, go call this number, and she just stood there and said, "I'm just observing." So there was kind of a little bit of an issue with wearing scrubs, that, you know, other healthcare people think that person was employed there. So we do not recommend you wear scrubs. Number 2 is very important. At each of the clinical sites that you go to do your observation hours at, you will need to sign off on a confidentiality waiver. That means what happens at those observation hours stays at the hospital. You don't go, maybe you saw your sister's neighbor and you can't go home that day and say, "Oh, hey, you know what? Mr. Smith was in the hospital. He's getting a chest x-ray taken and he sounded kind of under the weather, so you might just want to check up on him." Even though that's well intended, that's very, very, very against HIPAA and privacy laws. If there is a breach of confidentiality, you will not be permitted to apply to the radiology program. And that is something that the program and also our clinical affiliates take very seriously. Since these are observation hours, that is exactly what you will be doing. You're just observing and watching. You will not participate or assist in any way with any of the procedures. You will also be going into other work areas as well, so you might go for a few minutes into CAT scan or maybe ultrasound or nuclear medicine. Those are areas that are advanced modalities, so that means that once you get your first 2 years, your Associate of Applied Science, then you can go on with additional education and go into those different modalities. So when you graduate, you're not going to be doing CTs or MRIs or any of that. You're just going to be doing diagnostic imaging. It is important as well that wherever the clinical instructor, or if there's an assigned tech that's showing you around, and they take you to an area, that you please stay in that area. Please do not wander off. Again, feel free to ask questions. This is your time to find out what we do and to get as much information as possible for you to make an informed decision about whether medical imaging is the profession for you. However, we do want to make sure that you're asking questions when it's appropriate. So please do not ask questions in front of the patient. Maybe you saw an image and you went back out with the technologist and they're doing, the next image, and you ask the technologist, "What was that big white thing that we saw?" Well, it very might have well been just the heart shadow, completely normal. However, the patient's going to interpret, "Oh my goodness, something is wrong with me." So make sure that when you do ask questions, it is not in front of a patient or not when an exam is going on. Wait till the exam is over and then ask questions. Once you complete all of your observation time, there are some questions on your observation document, which I will show you in a minute. And that's the document that you will have to get signatures on. Cell phone use is strictly prohibited. You will not be permitted to have your cell phone on the floor whatsoever when you are observing. This is just to make sure, number one, that you are not taking any pictures of patients or video or anything like that, so that there's no confidentiality breach. And number two, it's just not professional. When you are going in for your observation hours, you will be evaluated, and we'll go over that evaluation form of exactly what you're going to be evaluated on. If there is any inappropriate behavior, that clinical facility can ask you to leave and ask you to not return, which means that you would not have completed your 12 hours at your 3 sites, so you would not be eligible to apply. when you go to Genesis to observe, you will need to print off the volunteer packet, which is located on our RAB webpage, and you'll need to complete that packet prior to attending your observation time. It is very important that you do complete it prior to attending, so that way when you go in for your observation hours at Good Sam, you can just hand that to Ms. Brown or whoever would be the designated tech for that day, and then they can forward that on to volunteer services. I will let you review over the job shadowing. And here is the clinical observation document. You will need to print this off. You will need to take this to each of the sites that you observe at. You will also need to get a signature from the clinical instructor or whoever is the designated tech for that day. If you do not have the signature, it is not a valid observation. So if you forget it for that day, then you are going to have to make a special trip back to have a signature that you were indeed there on this date and for these times. You'll definitely want to review the questions that you'll need to answer for those sites. So whichever site you go to as your first observation site, these are the questions that you're going to answer. Now, for the observation document, you can certainly handwrite. We don't need a book, just short answers are fine. But you'll want to review these because you can certainly ask the technologists and the students some of these questions as well, to get more information. So this observation document is what's going to go into your packet. Now we've come to our essay questions. If you applied last year, we do have a change in one of the questions, so you will need to update your essay that you've done previously. This does need to be typed following the format listed above, double space, 12 point, and following APA guidelines. This has been kind of an issue in the past. We've had a number of students not correctly cite on APA or not cite at all, which is actually plagiarism. If you are unsure about APA format or about grammar or punctuation or anything like that, you can go to the Learning Center and we do have a free writing tutor. So these are the questions that you will be answering. So what are the specific duties of a radiographer? What qualities or characteristics do you feel are essential for a professional team member? This is our new question from previous years. To identify 3 career goals that you wish to accomplish over the next 5 years, and you must provide corresponding action plans. So what are you going to do in order to accomplish, those goals? How does the didactic education or how does the classroom experience correlate to clinical experience? And then identify a minimum of 3 professional organizations directly related to radiology. So next in the information packet, this is one of the forms that you will need to print off and complete. This is going to be page 1 of your folder. You will need to provide us your current mailing address because we do send those letters snail mail. And then you will need to just answer all of the following questions. This section right here, you will need to read the statement and initial to make sure that that statement is true, and then your signature. So again, this will be page 1 in your application folder. This is the admission calculation form. This is the score sheet that we will be using to score everybody. Again, you can see it's kind of a graduated scale, so an A is worth more points than a B, worth more points than a C. This is our written essay rubric. So this is the grading rubric that we will be using to evaluate your essays. And this is your clinical observation evaluation. So when you go out to your observation hours, this is exactly what you will be evaluated on. And then the last part of our information packet is our course of study. So these are all of the courses that students will need to complete in order to graduate from Zane State with an Associate of Applied Science in Radiologic Technology. Now, it is not listed as a specific course in one of the semesters, but as part of graduation requirements, you do need to successfully complete the computer proficiency, which you can do a number of ways. You can either choose to take the proficiency exam and basically test out of the course. If you are thinking of transferring at all and going on beyond your associates and completing your bachelor's, I would not recommend that, because usually a credit by exam will not transfer to the next level. Usually you have to complete a course in order to do that. The BMCA 1010 would be the course that I would recommend for that proficiency. So you can take any of the courses that does not have an RADT listed in front of the number. And if you need any help with scheduling or advising, please feel free to contact me, and I would be very happy to set up an appointment and make sure that you have your schedule and it's correct and you are on the right track. This concludes our information video. At this time, you can now click anywhere on the screen and you will be directed to the post quiz. You will need to make sure that you hit submit at the end of that post quiz. You will receive a confirmation email that says that you completed that post quiz. Again, if you have any questions on the admission process or the profession in general, don't hesitate to contact me. Thank you for your interest.